The American College of Healthcare Executives on October 23rd and 24th in New Orleans offered its 2 day C suite program, Achieving Speed, Spread, Scalability, and Sustainability in Health Systems. If you missed this program, or if the key points covered in this brief video appeal to you, you can register for the next program by going to the hyperlink below, which will direct you to the ACHE registration website. A bit about the program. It is decidedly a CEO, COO, C suite audience in which, as senior strategists, the audience can share learnings and best practices found from their experience base versus a more middle manager level common to a lot of courses. It is taught by two CEOs, Kevin Cook, CEO of the University of Mississippi Health System, and Chip Caldwell, former HCA CEO. And it also enjoys amongst the highest attendee scores amongst ACHE programs. This venue, overall score of 4.86 out of 5, and both faculty received the highest 5.0 scoring. Some of the comments, Kevin was great. He added real world experience and was open to sharing what had worked and not worked, very engaging. Chip was an excellent instructor. He was flexible and open to questions in addition to being very knowledgeable. So how did we approach creating the 2 day program? When we examined a framework for PI programs and methodologies, we noticed that it produces results, but not always. In fact, sometimes there's a break in the chain of improvement. Well, why is that so? Caldwell Butler conducted national research to find out the answer to that particular question. We were able to identify 122 organizations who had achieved a $1.2 billion CFO validated margin improvement from 159,000 changes. And the framework of the 2 day course is to examine the population of top performers compared to bottom performers and process the answers to this question. What are your theories of why middle managers perform as they do in these two populations? Case in point from Dignity, now Common Spirit's flagship hospital in Phoenix, St. Joseph Health System, in which they achieved a $51 million CFO validated margin improvement after 5 100-day workouts, or 5.1% of their operating budget. That's a whopping 98% increase in net income. And by applying the same findings here, they were able to achieve a burst in patient experience improvement of 38%, when in the past couple of years they were eking out just modest improvements using traditional approaches. So how did they achieve those results? We observed that in the top performing group, they achieved margin improvement equal to 1% of their operating expenses every 100 days. Well, what were the key drivers of those successes? We were able to isolate 4 variables. First, speed, and secondly, spread and scalability, and thirdly, sustainability. Digging further, a peel of the onion revealed that top performers are exceptionally good at idea generation. And we're not talking about high-level benchmarking like 2.3 worked hours per ED visit, but rather, what is it that EDs who are top performers, what specific granular changes do they make? The second variable of mentoring leaders. The third variable of accountability structures, and the third, the ever important results feedback loop common to all good PI systems. We divide each of these 4 elements into 1/2 day diagnoses and spend time talking about what's working in your organization. What did we find amongst top performers? What do bottom performers do differently? As an example, I recall one CEO ask the audience, ask the faculty, We have been very successful in high reliability in the past couple of years, but we've seen our results wane or the magnitude wane of late. What are some suggestions from the audience and from the faculty, from the research that we might tweak or I might tweak back home to accelerate those results to where they were before? Another CEO wanted to process the question. She said, there's a lot of variability in skills amongst our middle manager group. Um, and I wonder from the CEOs, C-suiters in the attendance, as well as from the research, how can we develop our and mentor our middle managers when in fact we have such variation from strong performers to weak performers? Those are the kinds of questions that we cover during the 2-day experience. Um, Last observation, how does Caldwell Butler itself work with organizations in the use of this recent national research? Well, first, we aim to help organizations achieve burst improvement of 1% in operating expense every 100 days. That's why folks bring us in. We need a burst. We do that through the provision of 190,000 idea searchable database at cdatools.com. And once directors search the database for key ideas, we provide 2 hours per month per middle manager of mentoring by former CNOs. We provide that ever important results feedback loop also at cbatools.com. We're confident enough in our research findings and in our own work that we provide for a no pay guarantee. If we're so confident that we offer a no pay guarantee, if others that you may be considering to assist your organization do not have enough confidence to offer a no pay guarantee to you, why would you have confidence in them? So if any of the key points covered in this brief video appeal to you, you can register for the next program on January 27 and 28 in Clearwater by clicking on this hyperlink, or you can email me, chipc@caldwellbutler.com. Or if you would like to discuss offering this program as a planning workshop for your senior leaders back home, back at your organization, email me also, and we can have a discussion about that. Thank you for your attention.